What herbal combinations can be used for post-COVID coughing lasting for few months? Also, there is emaciation. So post-COVID coughing lasting for few months with emaciation. Your choice of
If a patient is not diabetic, then the best combination would be Kushmand Rasayana and Estimadu Ganavati. Kushmand Rasayana and Estimadu Ganavati will definitely will bring in the change in these conditions.
Whenever there is like chronic respiratory tract disorders, including asthma, in tuberculosis is very evident. Usually, patient start losing the tissues, and there will be severe dhatu kshaya where Yashtimadu with Sekushmanda Rasana that you told. This combination is kind of very effective, sir.
Definitely. And if a patient is diabetic, then avoid Kushmand Rasayana. Instead of that, you go with Yastimadu Ganavati and Ashwagandha Churna in the form of Kshirapaka. Yastimadu and Ashwagandha in the form of powder, and mix it with Kshira, make it a Kshirapaka Vidhi, and then that is better to give it, and it will not going to increase the blood sugars, but they definitely have a beneficial effect on tissue rebuilding.
Yeah, and there's a question: what would be the dosage for Yashtimadu for different reasons?
All the dosage should be according to the classical preparation dosage formats that should be used, not beyond that. Only concentration is that as a single drug, when you are using it, Estimadu, don't cross 500 mg. You make a tag on that. 500 mg is sufficient and it won't cause any problem. Once beyond 500 mg, then there may be in some patients, there may be some sort of nausea and vomiting.
And regarding its use in alopecia areata, Yashtimadu oil in particular, is it having any use, sir?
No, it's one of the good herb. It can be used in that, but to be specific on alopecia areata, better use Mahanimba Taila instead of Yashtimadu Taila. Mahanimba Taila will be more beneficial in that.
Okay. Most of the people who treat alopecia areata, they would consider this as a krimi. They would seek for krimi-hera action along with like twacha action together. So,
yeah, definitely. It is to be treated in that sense.
This is kind of a unique question. So when hair loss occurs on the eyebrows, so that only half of the eyebrow remains and the hair won't grow back, what does that indicate regarding their health?
See, it's very clearly loss of hair from the places where there is a hair. It may be mustaches, it may be beard, it may be head, it may be scalp, it may be eyebrow. All these comes under the category of alopecia areata. So if it is, you just try to find out whether it is alopecia areata, observe the pattern of hair loss, whether it is the shaft of the hair is broken or from the follicle itself the hair has lost. So if it is alopecia areata and half of the eyebrow is lost, then same what we use it as a drug of combinations like Mahanimba Taila and such everything, Narasimha Rasayana and those things which can be used even in there. And wherever that type of alopecia areata is there, then it usually the patient will have some sort of hormonal as well as immunological deficiencies and issues with their body. So that needs to be corrected.
Yeah, I mean, the alopecia areata can also happen in mustache and even beard also sometimes.
Yes, definitely.
And yeah, like I told, in cases of like testosterone deficiency, also I have seen a very severe form of alopecia areata. Yeah.
As well as hormonal issues as well as immunological issues. Two areas will come into concentrate when there is alopecia usually.
Okay.